Hello, and welcome to the Mid-Hudson Family Medicine Residency Program recruitment video. This slideshow is meant to orient you to our program in brief and just give you a little bit of information before your interview process with us. My name is Dr. Megan McMullen. I've been the program director for over 5 years at the Mid-Hudson Family Medicine Program, and I've been on faculty here since 2005. So welcome. Our organization partners with Westchester Health and Health Alliance Hospital here in Kingston, New York. We also have a partnership, obviously, with the larger Westchester Health Network, and our pediatrics rotations are done in Valhalla at our main campus, Maria Ferrari Children's Hospital. We have academic appointments at both Icahn School of Medicine at Mount Sinai, as well as NICOM, for osteopathic curriculum issues, as well as we have diverse relationships with medical schools, including Touro College of Osteopathic Medicine in Middletown, AUA in the Caribbean, as well as a new burgeoning relationship with CUNY and their medical school in New York City as well. Our program is conveniently located along the Route 87 corridor in the Hudson Valley. It's been a hot region for housing and development since COVID. A lot of folks escaped from New York City to our region, and it's increased a lot of the vibrancy of our community. You can search in the New York Times for some of the up-and-coming neighborhoods in our area as well. Our outpatient centers are located mostly in Ulster County on the western side of the Hudson River. Our major center is in Kingston. We also have a center in New Paltz and Ellenville. And we also have a center in Hyde Park across the river in Dutchess County that's affiliated with our organization. These are just some lovely photographs of the area. The first is a picture from Dutchess County looking back into Ulster County and the Hudson River, our beautiful foothills of the Catskill Mountains, as well as the creek as it comes through Saugerties on its way to the Hudson and over the waterfall. There's ample outdoor opportunities for hiking, biking, boating, et cetera, in the Hudson Valley. So if you like being outdoors, this is a great place to be. A lot of people want to know about our hospital. Our main hospital is the Health Alliance Hospital here in Kingston. Our inpatient service is run by our family medicine attendings, purely faculty-based, and we provide 24/7 coverage on that unit as well. We have a new renovated front half of our facility that you can see in the photograph on the below. It opened in late 2023, and the entire interior of the hospital got renovated as well into private and semi-private rooms. Some of the great things that we're doing are listed there on the slide. Interventional cardiac cath, as well as neurointervention, are two areas that the hospital is particularly proud of, as well as their new trauma designation. Our residents work side by side with attendings in our ICU on their ICU rotation. And we also have some telehealth capabilities with our larger network regarding stroke, neonatology, and trauma, which are utilized with regularity. Our outpatient health centers are really where our residents shine. However, our Kingston Center is the busiest and most robust in the offerings that it has, but all services are available to our patients regardless of where they live. We have specialty clinics in addiction medicine, LGBT affirming care, OMM, and behavioral medicine. We have an active teaching podiatrist as well, who's always more than willing to teach our residents about musculoskeletal medicine. And we've been working on our point of care ultrasound in the outpatient setting as well, both training our residents and some of our attendings as well in learning these capabilities alongside you. We do offer telehealth to our patients on the weekends. That mainly is not done by our resident staff, but it's a capacity that is available to our patients as well. If you've never been to the Hudson Valley, I encourage you to take advantage and come up and visit either on our open house days that occur after your interview day or just on your own on a weekend. We have an ample amount of rail trails that connect Ulster and Dutchess County. You can bike from one side of the river to the other. Probably over 100 miles of rail trails that are available. On the right-hand side is the famous Mohonk Mountain House, which is an area, it's a glacial lake at the top of a mountain. It's absolutely gorgeous. And the adjoining Minnewaska State Park, which is open to the public if you'd like to come visit. We also have rotations and elective opportunities here at our organization. You can read some of those bullet points from the slide. The major things are that we are some of the only learners in the Hudson Valley. So other than PA students, our residents are usually one-on-one with the attending and learning alongside them. We have some partnerships with local urology and ophthalmology rotations to get a little subspecialty care. And residents have done selectives and a variety of other medicine subspecialties. Our OB unit, our residents do complete dyad care. So they take care of both mom and baby as a couplet. And they are the only residents on that unit as well. We have 2 board-certified pediatricians on our residency staff as well, who help in the teaching of our residents, both inpatient and outpatient in pediatric care. We have a variety of certifications, trainings, and workshops that residents participate in ongoing. Most are listed there. The things that we're most proud of are our POCUS workshops ongoing, as well as our sports medicine workshop, which we'll see on the next slide. We do offer a residency support time called WRAP, which is led by both our psychosocial faculty as well as a professionalism component taught by our medical faculty regarding building skills for professionalism, ongoing, and resilience. Our sideline medicine workshop has been one of our great accomplishments over the last several years. We've done it in conjunction with Dr. Justin Conway, who also teaches at the New Vance Sports Medicine Fellowship. He is a graduate of our sister program in New York City in the past, and he has been very integral in uniting our family medicine faculty, as well as some of the trainers from our local schools where we provide sideline medicine care. This is a picture of not only our residents, but the residents from Mount Sinai as well as Harlem who come up and join us for this workshop. And it's held in Newburgh. Resident education is important. We have protected time for didactics each Wednesday. Residents have exquisite input into the content of what goes into that resident education. We're constantly working to improve both the diversity and quality of the education that they're getting at that time. We also participate with Mount Sinai with monthly grand rounds via Zoom, and we do a tri-residency didactic. So our 3 residency programs will collaborate regarding the teaching. We have an upcoming hospital medicine tri-residency didactic theme day. We also encourage residents to present their posters at both regional and national conferences. This is a picture from our recent trip to Philadelphia for the Family Medicine Education Consortium and an award-winning poster there. We are in the final year of our primary care training grant, which has allowed us to develop a variety of tracks, which we do plan on continuing ongoing regarding extra training and extra longitudinal training for interested residents. It's a completely optional program for residents, but some have opted into this program in order to gain extra facilitation in one of these areas. Osteopathy is incredibly important to us. My own primary doctor is an osteopath. We do Wednesday didactics at noon, where all osteopaths can join us, as well as allopaths, and learn techniques and skills and application therein. We are actively participating in hospital rounds as well for osteopathy, and we integrate some of this teaching into the Wednesday afternoon curriculum so that everyone gets a piece of this as well. We have an osteopathic clinic running both at Kingston and our New Paltz site at present. Some more beautiful pictures of the Hudson Valley, previously known as a area for agriculture. It's reinventing itself. The apple orchards are turning into distilleries and breweries to help kind of increase their bottom line. Also on the right-hand side and also behind me are some of the murals that you'll see through Kingston regarding the O Positive Festival. You can certainly look it up on the internet, but it's the exchange of art for healthcare, and it's also a big fundraiser for the Hudson Valley to take care of populations who otherwise wouldn't be able to access healthcare through traditional means. Being part of a federally qualified health center, it's incredibly important to us to be able to talk the talk and walk the walk regarding diversity, equity, and inclusion, both in our own staffing as well as things that we need, the types of education that we need regarding implicit bias and racism in order to eliminate it from healthcare. From an organizational perspective, these are some of the things that the Institute for Family Health is committed to in order to make sure that we become an anti-racist organization as well. Locally here at Mid-Hudson Residency, these are some of the things that we're doing specifically in order to eliminate racism from how we interact with the healthcare system as well. I know it's been kind of mind-opening for myself as a self-identified white cisgender person to be able to participate in some of these conversations and understand all of this a little bit more deeply. That concludes my presentation today. Please feel free to write down any questions you may have regarding anything upcoming that you would like to ask our faculty during your upcoming interview season. These are just pictures of our current residents having fun at a variety of our interactions, migrant health, some of our regional workshops, as well as Family Medicine Education Consortium. So we look forward to meeting you on your interview day, and thank you very much for listening.